Hello, students. This starts chapter 10, which deals with mainly compounding, extemporaneous, but it focused mainly on non-sterile, which is the opposite of sterile compounding. And I'll break down the differences between sterile and non-sterile. So again, this is chapter 10. So in this chapter, we'll cover several topics. And again, I'll probably break this into two lectures. So the different types of compounding, non-sterile compounding laws, regulations, and standards, the role of the technician in non-sterile compounding, and so on. Different compounding ingredients, weighing, measuring, and the percentage of error. So these are just different terms that we use in compounding. The process of weighing and measuring, and you can read the remainder. And here are more of your objectives of what you should get out of this chapter. Okay, so let's start from slide 7, types of compounding. So first, I need you to know what the definition of compounding is. So this is the process of preparing a medication from bulk ingredients according to prescription from licensed prescriber. So a bulk, when it says bulk materials, they basically mean raw materials or raw ingredients. Think of compounding very similar to baking a cake or just baking anything from scratch. Baking a cake would be a perfect example because if you wanted a cake, you got two options. You could go to a supermarket or bakery and just purchase a cake that's already made. What's similar in pharmacy is purchasing or a doctor writing for a prescription that a manufacturer has already made. The other option, let's just say the bakery was out of the cake that you specifically requested. Your other option is, and let's just assume everybody in town was out of that specific cake. Your other option is to actually make the cake from scratch. And that's where you would have to go and get a recipe, get all the ingredients like eggs, flour, icing, and actually make that cake from scratch. So that would be similar to compounding. So here are some situations that would require compounding, and just try to be familiar with a few of them, because there are certain rules about compounding that you must know, because you can't just compound anything. So here's situations requiring compounding. A dose for a pediatric patient, so this is like an infant, is smaller than a commercially available dose. So let's take amoxicillin. So the liquid formulation, the lowest dose it comes in is 125 milligrams per teaspoon. But let's say, for example, the doctor needed, for this particular patient, 40 milligrams per teaspoon. So commercially available, the 125 per 5 ml wouldn't work. It would be better suited if you were to compound it to a dose that'll be easier to measure. So this is one example. Dose for pediatric patients smaller than commercial available dose. And to the right, they give you an example, preparing 10 milligram capsules from 30 milligram tablets. This is a very common one, the second one. Patient cannot swallow solid dosage forms. And this could be a lot of different reasons. The patient could have a gag reflex, or it could be a person with a G tube where they can't swallow solids. Could be a very elderly person, could be again, a pediatric person. And in this case, you will prepare a suspension from tablets or capsules. In that case, like for example, if the medication was only available in tablets and the patient cannot swallow tablets, you can compound that tablet formulation into liquid. Dose for veterinary application that's not commercially available. This is very, very common, and you'll often encounter this in pharmacy. Believe it or not, you get prescriptions from veterinarians. Animals do get sick, whether you own a cat, a dog, a bird, whatever it is. just like humans, you'll be surprised to know that many of them also have diseases that you probably thought were just pretty much suited for humans. But I filled, as when I worked in retail pharmacy, I filled prescriptions for cats that had anxiety, dogs that have diabetes, thyroid issues. Done that before. So animals also have medical conditions that humans have, and typically the dose that's commercially available, you have to sort of compound it because the animals could weigh far more than a human or far less. In most cases, if it's a pet, they usually weigh less than a human, especially like a little 5-pound cat or 7-pound puppy or dog. You have to prepare a special dose in those cases. And keep in mind, if you got places like Fort Worth Zoo or the Dallas Zoo, those animals sometimes get sick as well. So they, meaning the zoo, will have to call in prescriptions via a veterinarian to, it's usually an independent pharmacy that specializes in compound, because those animals need to take medicine as well, and they have to be specially compounded. Medication that has an unpleasant taste. We see this more so with children. There are certain medications, and there are a few antibiotics that the child just doesn't like the taste of it. The mom or the dad gives the child the dose, and the child spits it right back out because it doesn't taste good. And that doesn't help the child any, because if they spitting out the medication, they're not getting the actual medication that they need to get better. So what we can do in the pharmacy is we can add flavor to the medication to mask the original flavor. So this helps the child to be able to consume the medication. Oral medication causes adverse effect. So some people swallow pills or capsules and they get an adverse effect. In certain situations, you can take an oral medication, whether it's tablet or capsule, and you can convert it to a gel. So preparing a gel for a patient who has ulcers from oral medication, that's possible, because if it's a gel, the medication will still get absorbed through membranes, so they'll still get the active ingredient. So these are just a few examples. Okay, so here's the difference between sterile compounding and non-sterile compounding. And if we were actually in a classroom setting, there's usually a lab where I have the students actually prepare a non-sterile compounding. And they're usually very easy. I want you to know that the big difference between sterile and non-sterile, in the classroom setting, we could not compound anything sterile. The reason why is because of the technique that you have to adhere to if you're using sterile compounding. Sterile compounding has to be free from any kind of contaminants or microorganisms. In order to ensure that, you have to have a specialized, what they call a clean room. The clean room is bacteria free. You have to be fully in the proper garb, meaning you have to have gloves on, you have to have scrubs on, you have to have, I think they call footsies, which you put over your shoes, where you don't bring any germs from the outside. The bonnet, you have to wear that. Some cases you have to wear a face mask, which is popular these days. So in sterile compounding, you have to follow what is called an aseptic technique. And so this technique actually ensures sterility, because if something is sterile, it cannot have any types of contaminants whatsoever. So these sterile compounding uses aseptic technique to prepare solutions free of microorganisms. So this is the big thing. Usually sterile compounding is going inside the body, or is going in the eye, a place where you cannot afford to take a risk of having any kind of contaminants. So medications prepared in a clean room environment. Again, these are, you would have to see one of these at institutional pharmacies. Some compounding pharmacies have these, but they weigh in the back. You would have to physically go in there and go into the back. to actually see the room. And they have these huge filters that are connected to the room that basically is filtering air particles. So the whole room is called a clean room. And again, you mainly see these with paternal. These are, paternal is another word for IV or injections, and ophthalmic medications. So in both cases, remember, if you put something in somebody's veins, you definitely don't want any contaminants, because once it's in your veins, it's not coming back out, and it has to be sterile. And obviously the same thing with eye medications. You have to, the eye is sterile. You can't put any contaminants in the eye. I don't know if Misty went over this, but this is a good thing to know. Sometimes it comes up as a PTCB question. You got ear drops and you got eye drops. And sometimes you have the same medication. One is for ear and one is for eye. Like, for example, neomycin, that's an antibiotic. They make ear drops solutions, and they make eye drop solutions. What you can do, or what the doctor can legally do, is a doctor can prescribe an eye drop to go in the ear. Okay, so a doctor, and this may confuse you sometimes, because the doctor could write a prescription for a antibiotic eye drop, and then you look at the directions and it says instill in the left ear or the right ear or both ears. That's perfectly fine. You can always double check with the pharmacist just to make sure. But you can put, and that's CAN, you're allowed to put eye drops in the ear. What you cannot do is put ear drops in the eye. If you happen to mix that up, like, for example, a doctor writes for a eye drop, and you accidentally select the ear drop formulation, and the pharmacist doesn't catch it, and the person goes home and instills the ear drops into the eye, that's a big problem. Potentially blindness. What normally would happen in most cases is, and you just have to cross your fingers that the patient will do this, as soon as you put ear drops in the eye, it will sting and burn like crazy. So usually the patient will alert the pharmacist or the doctor's office, hey, I use these eye drops and they're burning. And then you can double check and make sure, the right medication was dispensed. But if the patient just keeps using it thinking that the burning sensation is a normal reaction, that could be very dangerous and lead to potential blindness. And so if you look on the right column, non-sterile compounding. So these are medications not prepared in a clean room. So we could do non-sterile compounding if we were at the Dallas College campus. We can do that in the classroom. And you can actually do that in the pharmacy in the open, because they don't require the medication to be sterile. Uses guidelines to get medication as free of contamination as possible. Now, I'm not saying that because it's non-sterile, you could compound it in any fashion you want, or you can, your table could be dirty, you still can compound it. That is not what I'm saying. Your area still has to be clean, whether you're doing sterile or non-sterile. It's just that the sterile requires a certain technique. You have to have certain machines that filter the air. It has to be free of contaminants. Whereas non-sterile, you just have to have a clean working area. So only allowed for medication dosage forms that are not commercially available. And let me, this is a key thing that I want you to know, of which you can actually compound. For example, let's take a medication, let's take metformin 500 milligram, popular medication. So that's commercially available in a tablet form. A pharmacy cannot basically compound metformin 500 into a liquid unless the patient cannot swallow the pills, because the tablets are commercially available. When pharmacies compound, they actually make a little bit more money because it's an added service that you're providing, and you're billing the insurance for an additional service. So you have to have a legitimate reason to compound a medication. And if it's commercially available and the patient has no problem taking a metformin 500 milligram tablet, then you should not compound it into a liquid, because that's considered insurance fraud. There's no reason for you to compound. If the patient has no issue taking a tablet, which is commercially available, and you compound into a liquid to make extra money, again, that's insurance fraud. But that's something more so that a pharmacist, decision pharmacist would have to make. So as a tech, just kind of know that you're only allowed to compound medications that are not commercially available. So non-sterile compounding, and I will send a few YouTube videos that shows this technique. It's very easy. If you look at this slide on page 9, these are some of the common apparatus that you have. All the way to the right, what looks like a knife a little bit. This is your spatula. So remember, you use this for compounding as well, because sometimes you have to mix ointments or you have to blend them together. And this is the same instrument or same device that you use for counting pills. This white bowl and this clear plastic device here, this is your mortar and pestle. So the white bowl is your mortar, and the little clear device is your pestle. This is mainly using for crushing and grinding tablets into a fine powder. This is one of the oldest techniques pretty much around today in the medical field. Even if you go back thousands and tens of thousands of years, cavemen used something very similar to this. When they got sick and they found out that a certain plant produces relief from a certain sickness or whatever, even back in those days, the cavemen would take the leaves of a certain plant and they would place it against a hard object. Just think of that as your mortar, and they will actually grind the leaves together to break it down. It's the same technique. And this is still used today. Technology has not replaced the mortar and pestle. You will find this at any pharmacy. There are some machines that you can grind tablets, but be honest with you, most pharmacists and most techs still like to use the old mortar and pestle. Okay, and these are just your ointment jars, the one with the big red top. So non-sterile compounding, typically extemporaneous. This is prepared for a specific prescription for a specific patient. So usually when you're doing non-sterile compounding, if it's commercially available and you're compounding it, is usually because the patient cannot take the commercially available formulation. Hospice medications. The term hospice means basically somebody's approaching end of life. So sometimes if a person has a terminally ill cancer, the doctor may say, well, you have about 3 months of life remaining. And usually they'll put them into a category called hospice. So it tries to make their remaining days free of suffering. Usually hospice, when a patient's on hospice, all their co-pays are waived. And usually if they're in hospice, they're in pretty bad shape. So the patients have difficulty swallowing tablets sometimes, and you have to compound it to a liquid. Again, we just mentioned veterinarian medication. Remember, animals come in various different size. People could have a pet that's 4 or 5 pounds, and think of animals at the zoo like a hippopotamus or elephant that's a couple tons. So it all depends on the animal size of what type of medication it will be, because the bigger it is, the bigger the dose is going to be. And this is just a American Veterinary Medical Association. This is just a guide for veterinarian prescription drugs. You won't run into that too much unless you work at a compounding pharmacy that does a lot of veterinarian prescriptions. So non-sterile compounding, 3 levels of complexity: simple, moderate, and complex. And this is pretty accurate. You have they have put this into 3 different categories. There's some compounding that's very simple. You just add this and add that, maybe shake it, and you're done. So those are the real easy ones. Like the one popular one is there's a medication where you mix Maalox, lidocaine, and Benadryl into a solution, and it's good for like mouth sores if you get sores in the mouth. But it's real easy. It doesn't even require any calculations. You just have to look at the prescription, and the doctor will put maybe 60 mLs of Benadryl, 60 mLs of lidocaine, and maybe 120 mLs of Maalox, and you just add the quantities together, shake it well, and you're done. Nothing complex about that as well in any form. Then you have moderate. Moderate compounding is when you have to do a little calculations. Some of these will include the most common one. Hopefully, you went over this in your math course. Is alligation. You have to know alligation to do compounding. That's by far the most common math formulation that you will use when you're compounding, and by far the most popular. So it requires some special calculations. You just know the formula. Complex, you don't see the real complex too much unless you're working at a nuclear pharmacy. Sometimes you may have to do IVs that require special formulations, but that's pretty rare. Usually the majority of compounding are simple or moderate for the most part. So this is just the Food and Drug Administration Modernization Act of 1997. Only thing I want you to know about this is just this law basically said when pharmacists compound non-sterile medications for patient, the medications must meet the USP standards. This stands for United States Pharmacopoeia. State boards of pharmacy oversee compounding pharmacies. So sometimes when the state board visits your pharmacy, if you compound, they want to see a compounding log to make sure. Oh, the screen disappeared. Hopefully it'll pop back up. Okay, there it goes. So they usually want to see a, oh, I don't know why it's doing that. But basically, they want to see a compounding log. They want to make sure they will check and make sure that your scale is working. That's one of the first things they do. They'll tell you to plug in your scale, and they'll have you weigh something, and your scale better be accurate because they're going to wonder, how are you doing all these compounding and you have a scale that doesn't work? So you have to meet certain standards. You got to make sure the area is clean. They got to make sure you're not doing any sterile compounding if you don't have a clean room. And these are some other organizations that work with the state board to ensure compounding quality, safety. You don't have to know these by name, but just kind of know that the Food and Drug Administration Modernization Act, it basically established standards for compounding. And this is a continuation of it. So remember, compounding commercially available products is prohibited. So that's for insurance fraud reason. If the medication is available in tablet, the pharmacist can't say, well, let's just make a little extra money and compound this into liquid. Typically, you're compounding if something's on back order or if it's a specific dose that they don't make. Now, keep in mind, just say, for example, metformin. Metformin comes in 500 milligrams, 750 milligrams, and 1,000 milligrams. So those are all commercially available formulations of metformin. The doctor may have a special condition where the patient needs maybe 815 milligrams of the dose based on the doctor's diagnosis. Since it doesn't come in 815 milligrams, you can, and it comes 500, 750, and 1,000. Since there's no 815 milligram tablet, you can compound that because it's not commercially available in 815 milligrams. But again, if the doctor writes for metformin 500 milligram and that's commercially available in tablet form, you have to use the commercially available form unless the patient cannot swallow tablets. So these are the other rules. You can look these over. Compounding pharmacies are not required to follow current good manufacturing practices, adhere to product labeling, or submit drug approval applications. So when you're compounding, you're not doing the same as manufacturing. Those are two different types of industries. You're not doing mass production, so you don't have to follow those same rules. If community pharmacy sells to healthcare professionals or out-of-state pharmacy, they must apply for manufacturing license. So that's a big difference. Manufacturers create, so the manufacturers are like the drug companies, the big drug companies. They create mass productions of these products and they sell them. When you're compounding, you're just filling a prescription for a customer. But if you were trying to compound a medication and try to sell it to other doctors or to the public, you're now a manufacturer. So you have to, that requires a special license. And these are some of the other things. You have to have accreditation. You have to basically, the pharmacy must agree to meet all standards for sterile and non-sterile compounding. That's a no-brainer. Includes monthly or quarterly spot check. More than likely it's quarterly. They will have auditors to come out and check your equipment and make sure that you are compounding products that are up to standards. And these are some of the things that they look for. Yeah, you can just look at this for FYI. You don't have to memorize them. Okay, there are three numbers that I do want you to basically know, if you can just associate the numbers for what they represent. So remember the USP, the United States Pharmacopoeia, that's a big book with a lot of chapters. And when it comes to compounding, there's basically three chapters that are exclusive for compounding. So just kind of connect the numbers with what they represent. So the first one is chapter 795. 795 just basically gives you all the rules and regulations for non-sterile compounding. So somehow associate 795 for non-sterile compounding, because this comes up usually on the PTCB. They'll ask what chapter has all information for non-sterile compounding, and you get four choices with four sets of numbers. And the one you have to go for is 795. Chapter 797 in the United States Pharmacopoeia just focuses on sterile compounding. So if you wanted to know all the information, the rules, the regulations, guidelines for sterile compounding, you would refer to chapter 797 because it's sterile, not 795. 795 would be non-sterile. And then there's one more, 800, chapter 800 in the USP. That's for hazardous drugs. You won't see that too much you definitely won't see it at the retail setting, or probably not even institutional. But they have pharmacies like nuclear pharmacies, which have pretty dangerous drugs. Like if the drug gets on your hand, or if you accidentally consume it, these drugs could cause immediate danger to you or whatever. Some drugs are pretty much, a person cannot physically touch them. So this chapter dedicates all the rules and guidelines for handling hazardous drugs. So just try to remember these three numbers. 795 is non-sterile, 797 is sterile, and 800 is hazardous drugs. That's all I want you to know from that. This one, basically, just kind of look over it. It's pretty much FYI. I don't need you to basically remember everything that's on page 15. It just sets the rules and regulations for non-sterile compounding. But just kind of overlook at it. I wouldn't dwell too deep into it. So let's see if we can answer this. True or false, a pediatric dose that is smaller than what is commercially available would require compounding. So if you take a minute to think about that, your answer should be true, because there's no way you can compound it, because it's not I mean, there's no way you could actually dispense it commercially, because that dosage is not commercially available. So that should be true. It is okay to compound a commercially available product. And as I went over this a few times, answer is no. If it's commercially available, you use the commercially available product, unless the patient cannot swallow that commercially available product. But you can't just compound something that's commercially available just for the heck of it. So that should be false. And the last one, U.S. Chapter 797 provides standards for compounding non-sterile products. So remember, you had 797, you had 795, and then you had 800. So 797, this is was not for non-sterile, that was for sterile. So just make sure you remember these numbers. Now here comes your job, the role of technician in non-sterile compounding. So mainly the big chains, Walgreens, CVS, and Walmart, they don't do as much compounding, if any, these days. They usually send those prescriptions to independent pharmacies that specializes in compounding. But it's possible that you could work for an independent pharmacy that does compounding. So here are some of the technicians' compounding duties. And again, the pharmacist, just like in retail, you're under supervision of a pharmacist. You retrieve the recipe. This is basically the recipe. When we talk about compounding, recipe is basically the prescription. You gather the ingredients. So once you look at the prescription, you look at all the information that you'll need. You gather the ingredients. You may need a certain liquid, certain tablets, just whatever's on that prescription. Because if you're combining different products, you want to pull those items from the shelf. Calibrating equipment. You want to make sure that your scale has been calibrated. This is not something you would actually do as a technician. They do. This is more so a pharmacist's responsibility to make sure the equipment is properly calibrated and actually working. Then you have to do your weighing, your measuring, your mixing, preparing, checking, your ordering inventory in case you don't have the product. Beyond use dating is basically the same as an expiration date. You mainly use beyond use dating when you're doing, well, actually when you're doing any compounding, but mainly you can get that information off a website. The USP has that website. Typically, most ointments or creams usually last about 90 days, give or take. So this can be accessed in the pharmacy's intranet. Remember, when you're compounding versus manufacturing, there's a big difference. Manufacturers, like when you order a bottle of, say, metformin from the warehouse, when you get that bottle in, if you turn to the side, you may see expiration date July 2024, so 4 years expiration date. Now, when you compound, you will never have an expiration date of 4 years. I don't even think I've seen an expiration date of 1 year. The main reason behind that, if you want to think about why manufacturers have long expiration dates, and when you compound in the pharmacy, it's usually a couple months at the most. The reason is a word that begins with a P, and that is preservatives. Remember, manufacturers, since they do bulk manufacturing, meaning they do large amounts of manufacturing, they add preservative to those products. The preservatives are inactive ingredients, and their only job is to actually extend the life of the product. So manufacturers will have longer expiration dates. Compounding, you don't add any preservatives to the product, so you're going to have much shorter expiration dates, much shorter. Then obviously you have the printing and affixing of labels, because you got to label it just like you label any other medication. And obviously keeping the workspace clean. So once you're done with one compound, you want to clean that area extremely well before you start your next one. Certification of pharmacy technicians. So I don't know why this is on here, but this is just a no-brainer. Compounding, usually a tech in training can do compounding under the supervision, but they're for certified pharmacy techs. Obviously, you have to pass a national exam, which is a PTCB. Math will come to great use when you're doing calculations, or just overall compounding. Many certifications in laboratory training in non-sterile and sterile compounding. Now, to do sterile compounding, especially if you work in an institutional, you have to be certified to do that. And I believe Richland, or I should say Dallas College, offers a IV certification program. That's why typically, since you have that added certification, typically technicians who work in an institutional and who are IV certified, they usually make a lot more than retail pharmacists. Usually, from what I hear, their introductory rate is usually 18 to 20 an hour, starting rate for IV certified technicians who work in institutional, because that's an added skill that you have to have. Additional training required for compounding with a hazardous substance. So this is just more of a CE training. USP standards regarding education of personnel. Training is ongoing and reevaluated annually, so you have to do CEs every 2 years just to keep up to date with all the new procedures and practices. The non-sterile compounding process and documentation. You have what is called a master formulation record. These have to stay on the pharmacy. Basically, what it does is it outlines everything about that compound that you did: the drug name, the drug strength, the drug dosage form, the ingredients and quantities that you use. If it required calculations, you have to put what calculations were used. It has a section where it asks you what is the step-by-step process you use to compound. You have to have the beyond use dating expiration date, and the storage and label information. So it's called the master formulation record. So it's just a sheet of paper with all that information that the pharmacy has to keep on file. Compounding record. This is basically a little bit more detailed. So the compounding record would actually print out, and it'll have the patient's name, the prescription number, the date of compounding. So it's just almost similar to how we store regular prescriptions in the computer. We have to have a compounding record to store all the information of any compound prescription that got dispensed. And these are going to vary just depending on what pharmacy you work at, but they all pretty much have the same similar information. So technicians must document the NDC number, the lot numbers, expiration date of each ingredient, and it's very much self-explanatory. So if you were making this product, this is a mouthwash, magic mouthwash. So these are the products that the technician pulled. So the technician pulled the lidocaine. It required 60 mLs. So this is the manufacturer that the tech used, the NDC number. Usually they have to list the lot number, and this is the expiration date. Prepared by would be the technician who prepared it, so they will initial there. Checked by would be the pharmacist, and then you just go down each one and list the information. It's very easy. And then you got prepared by, this would be the technician. Approved by, this would be the pharmacist. This is the date, directions for the prescription. And then they'll ask you, was there any auxiliary labels that you put on the bottle? So this one will have a shake well. Again, here's the patient's name, and it'll have their RX number. The master control record number will be a number that the computer selects, so you don't have to actually input that. Very easy process. And here are the 6 steps that they have for the compounding process. Again, I'll send you some YouTube videos. Compounding is actually fairly simple. So these are the steps that you go through. Pharmacists, judges, wait, let's see. So it starts here. Actually, it starts here. So pharmacist judges suitability to prescription. Technician retrieves and reviews the master control record. Technician prints out compounding record. Technician performs calculations and identifies necessary equipment. And before the technician begins, the pharmacist has to check the calculations to make sure it's correct. Medication container label created. And technician uses appropriate protective clothing, hand washing technique. So when I show you the YouTube video, it'll make a little bit more sense. And then here's the other information. Technician gathers all the ingredients, prepares and calibrates equipment. Again, this is very similar for those of you who may be cooks. If you're a good cook, even if you're reading from a recipe, think of the recipe as the prescription. The recipe tells you all the ingredients that you need. If you're a good cook, you would get everything out. Just say you were baking a cake, you would get the flour out, you would get the eggs. You wouldn't. It's sort of better if you just had all your ingredients out right in front of you, all your equipment. If you're using a blender, all your equipment out in front of you. You don't want to just keep running back and forth, back and forth. So a good technician will have all the ingredients out, make sure the equipment is working, weigh out the products and ingredients, just like you would do with if you were baking a cake. It tells you 2 eggs or 3 eggs, you would do that. It may tell you to use a half a cup of this or 3/4 milk or whatever it is. You want to have all that ready. Technician stores product in suitable container. And then again, you can just look through these steps, but I'll send a video that'll be a little bit easier for you to follow. And that ends with 13 and 14. Those are the final steps. The pharmacist always counsels patient at pickup. Proper garb and for non-sterile compounding. You got to wear clean protective clothing. Again, you'll see these in the video. Hairnet, long lab coat, disposable gloves. If hazardous chemicals, eye goggles, mask, double gowning. Face mask not required. This is probably pre-pandemic. I'm pretty sure now it's no matter what pharmacy you work at, you got to wear a face mask full time. So this was probably written pre-pandemic. But typically, in most cases I see in institutional settings, the technician usually has on a face mask. Specific requirements described in pharmacy's policy and procedure manual. This is a little FYI. This is like, obviously, you wouldn't take your cell phone. You wouldn't answer a call. You wouldn't. You're not supposed to wear jewelry, rings, earrings. These are all in the procedure manual. Again, here's more proper garb. So this is a technician measuring up the information. This one is more than likely a sterile, the one on the left with the lady. The one on the right, obviously this is non-sterile because they're not in the clean room. I can see the prescription bottles in the background. But this is how they usually dress in non-sterile. Non-sterile, I don't know why they have the hairnet and everything. It's usually not needed. CDC, hand washing and hygiene. You should be familiar with this acronym. Center for Disease Control. Again, CDC was very popular with COVID-19, all types of recommendation. Proper hand washing is the single most important practice to prevent contamination, reduce transmission of infectious agents per the CDC. After you have washed your hands, use a sterile, clean, drying towel to turn off the water. And again, I'll send a video of this practice. And this is just a little FYI. This is supposed to be good hand washing technique. A lot of people actually wash their hands and probably think they're doing it the right way, but in the medical field, It's a certain technique that you have to follow. It's not the typical washing your hands that you do at home. As you look at this little diagram, you got the rubbing, you got to rub in between the fingers, both hands. You scrub the forehand, the thumb, and again, you do the other hand. So it's a little bit more intense than what we think of in our normal hand washing procedures. This is the way you're actually supposed to do it in the medical field. Okay, true or false? USP, good compounding practice has standards regarding educational personnel. That is obviously true. The accreditation by the Pharmacy Compounding Accreditation Board is involuntary. That's definitely false. That means you don't have to be accredited if you don't want to. So that's obviously false. Face masks must be worn when compounding non-sterile products. So non-sterile, it doesn't need to be worn. Sterile, it will need to be worn. But like I said, right now with COVID, I'm pretty sure everybody has to wear a face mask all the time. But if this question came up on the PTCB, you don't need to wear a face mask when non-sterile. So this would be false. A product's assigned lot number should be included on the compounding log. The lot number and NDC and expiration date should be on there, so that should be true. Okay, so I'm gonna stop here and do the next half shortly. So, because this is slide 30 of 60, so I just want to break this down into two parts. Any questions, feel free to contact me. Thank you.